Chemotherapy for cancer treatment often results in collateral damage to healthy cells and other adverse effects. A research team led by City University of Hong Kong recently developed sono-sensitized chemotherapy (SSCT), a new form of ultrasound-activated chemotherapy which further enhances the precision for eradicating deeper tumors with centimeter range of tissue penetration and minimises side effects. Photo-activated chemotherapy has successfully enhanced treatment by providing location-specific therapy with reduced adverse effects. However, its shallow penetration depth and strong optical scattering have yet to meet the need for a non-invasive therapy capable of precise ablation of deep tumors. To overcome this limitation, the research team invented the SSCT technique by developing Cyaninplatin, a sono-activatable anti-cancer prodrug, and tailor-making a programmable focused ultrasound system (FUS) for sono-activation. Cyaninplatin is a small molecule platinum-4 anti-cancer prodrug. A prodrug is a pharmacologically inactive compound before activation inside the body, with a modified ultrasound responsive theranostatic, that is combination of diagnosis and therapeutics, platinum coordination compound, and a carboplatin-based platinum-4 scaffold. It accumulates well in the tumor region, and when irradiated with ultrasound, it is reduced to carboplatin, which is a typical chemotherapy drug. When activated by focused ultrasound with spatiotemporal control, it can focus directly on cancer cells. In their experiments, the team found that the ultrasound-activated Cyaninplatin sufficiently induced cancer cell oxidation, eventually leading to mitochondrial DNA damage and cancer cell death. The researcher says that another fascinating part of the research is that they successfully utilized ultrasound's property of deep penetration in tissues for the activation of small molecule drugs. Previous research reported that photoactivation with near-infrared light was effective only in the millimeter range and performed poorly when the cancer cell was covered with thick body tissue. But combined with the customized FUS, the treatment with ultrasound-activated Cyaninplatin successfully inhibited cancer cell viability by 51% with 1 cm thick tissue coverage and 33% with 2 cm thick coverage. The well-designed FUS enables the SSCT to be a precise tumor-specific treatment with good penetration performance. More importantly, the system allows the ultrasound to focus on a specific area within 8 mm and hence highly focuses the ultrasound energy on a tiny area to activate sono-responsive prodrugs, providing an efficient approach with minimal side effects. In addition, the prodrug's fluorescence property enables it to act as a multi-imaging contrast agent, allowing the visualizing and the reconstructing of a tumor in a semi-3D fashion. This provides accurate guidance for applying FUS at a tumor site and monitoring the drug accumulation time. To further explore the efficacy of SSCT, the team injected inactivated Cyaninplatin into mice with tumors. After the fourth treatment on day 6, the ultrasound-activated Cyaninplatin drastically inhibited the growth of tumors and completely eradicated 2 tumors. In contrast, there was no inhibition of tumor growth for the untreated groups. The tumors continued to grow. The ultrasound-activated Cyaninplatin also lowered the level of the tumor proliferation factor to 24%, preventing potential tumor recurrence. And there was no notable loss of body weight, no abnormal behaviors, no systemic toxicity to the main organs of the treated mice. The researcher says that the ultrasound-activatable prodrug can be further extended to preclinical or clinical studies for cancer treatment. The findings in this study may provide an important reference for developing novel therapeutic approaches, providing new dimensions for anti-cancer treatment, and broadening the field of medical ultrasound applications. The findings were published in the scientific journal Science Advances under the title "An ultrasound activatable platinum prodrug for sono-sensitized chemotherapy."